Hi, good afternoon, good morning, depending on your coast. I am Allison Emrine, the Director of Operations for the VHA Innovators Network. And I am happy to be here with you for day 2 of the Breaking Boundaries Collaboration Challenge. And very, very pleased to introduce the Chief Officer for the Office of Healthcare Information and Learning. To start us off on a great day, and Brian Vega, Dr. Vega, would you like to join us and kick us off today?
I would. Thank you, Allison. It's an absolute pleasure to be with you all today. I would be remiss if I did not acknowledge, particularly coming from the Veterans Affairs Department, the tragedy that has unfolded in Afghanistan over the past 24 hours. The Secretary of the VA has sent out a memo to all employees asking that all VA employees observe a moment of silence for 1 minute at 3 o'clock Eastern today. I won't be with you all at that time, but we can, at least I would ask if we don't mind observing a moment of silence now. And remembrance to the service members who gave their lives in the hopes of saving others. Thanks, everyone. So, one of the core reasons we all are all here today, as we reflect and remember the honor of those service members, is the millions of them that transition from military life into veteran status. That we have in the VA what I believe is the highest honor and highest mission, and that's to care for them and their families who have borne the battle. And in order to provide world-class care, innovation must be a core component of what we do. But it's not necessarily innovation that comes from every frontline employee. It's innovation that comes from all of us. It's innovation that comes from startups to Fortune 500 companies, even companies like Apple and Google, who are entering in the healthcare space but weren't traditionally players before. It will take all of us to remember and to honor their service and to ensure that their ability to receive high-class and world-class care is an enduring promise that we keep. So you all's role and you all's position to help us in the VA do that is one that we take of great importance. I want to talk a few minutes about how we are building a more global culture of innovation, and how we are committed to building the infrastructure that will allow us to innovate the path towards high value care and set the standard not just for VA, but for healthcare across this country and even globally. A few months ago, VA received its first FDA authorization for compassionate use authorization for a medical device that up until that point didn't exist. It was a veteran, his name was Nicholas Giavetti, who had bilateral hearing loss from his canals being collapsed. Now, traditionally, this is quite rare, but traditionally it requires surgery. Now, Mr. Giavetti, being a former engineer in Vietnam, said, you know, I could probably put some hearing straws in my ears and it would help me open up. He joked he would selectively remove them if his wife was talking. And he always had the excuse, well, honey, I'm just deaf. It's not because I wasn't listening. But our engineers and our 3D printing experts came up with an incredible idea. What if we created a medical device, a stent, using additive manufacturing that we could create and put in this gentleman's ear, save him from surgery? And so they did that, submitted the paperwork to the FDA, and now it's undergoing further studies to help serve not only veterans, but patients across the country who could benefit from this device. The other one, which is not as much technology focused, but equally important, is the Pride in All Who Serve program. It's a 10-week course focusing on reducing disparities for LGBTQ veterans. It's spread by word of mouth to over 40 VA medical centers in under 3 years. And I think one of the comments we heard from a veteran really just summarizes the impact of this innovation. They said, and I quote, "I was going to kill myself until I found this program in a community that made me feel accepted." Pretty powerful words, and shows the power of these types of innovations. So as we think about not only the infrastructure that we're building and the importance of your role in helping us conceptualize and foster innovation, I want to bring in somebody who I not only admire, but who is equally our boss, and who's somebody whose insight towards this idea of how we advance care to deliver high value care spans decades, really. And that's Dr. Carolyn Clancy. Dr. Clancy, a question for you as you think about where we are today and where we're going. What does the concept of breaking boundaries mean, and how do you see the VA doing that for our veteran population?
Sorry, can you hear me now?
We can.
Oh, great. Sorry about that. I would say VA has been breaking boundaries for for decades. That goes through our 95-year-olds research program. We are, as well as the impact we have on future healthcare professionals, to the phenomenal research that we fund, and now the innovation ecosystem. So we have strongly encouraged people to develop new ideas about best practices. And in fact, the most exciting thing I heard recently was at the Madison VA, where I dropped by for a short visit, and they worked this into new employee orientation, right? Don't wait. You don't have to go up the chain to get permission. If you have an idea, go for it, which I thought was just inspiring, because that's how we need to think about innovation. In the past year, of course, this has served us well. VA was way, way, way ahead of the curve with telehealth. So in the pandemic, we didn't have doctors saying, how do you spell Zoom? Is that with a capital Z or a small z? Which is what some of my classmates from medical school were all about. This was just a matter of how do we expand and how do we reach veterans where they are, and I think is going to put us on a very, very different trajectory for the future. So I'm very, very excited to be with you. And just during a recent week in August, I think we had over 172,000 telehealth visits, clearly part of the fabric. That's why I say breaking boundaries is part of our fabric as well.
Yeah, I couldn't agree more. And one of the things that often comes to mind, and one of the questions I think that's asked of us is what is the role of sort of making innovation and transformation in healthcare happen, and how do those collaborations work? I think people often think that their partnerships may end with a VA medical center and not potentially have a much broader impact on the healthcare landscape for patients all across America. They think it's just sort of impacting locally. And I think when we look at something like Codometrics or the initiative to end diabetic limb loss, this is a years-long collaboration where we're not only able to provide some of the evidentiary standard that the solution is practical, but that the clinical impact, the financial impact, some of the questions that our private sector folks may be a little bit more in tune to or concerned about at the onset, we can answer this for them. And some may say that that is part of our responsibility, not only to providing world-class care to veterans, but as a American system funded by taxpayers, that the ability for us to translate those innovations to move American healthcare forward, that no other entity serves in a more unique role or opportunity than VA does. When we talk about the workforce and the mission, Dr. Clancy, I think about some integral components to how we innovate, whether it's culture, and we sort of throw that word a little bit around maybe loosely. But from your perspective, so what is essential when we really think about how we innovate and then how we collaborate around innovation?
So one of the things I think it's really important to keep in mind is the role that veterans themselves play in innovation. They are the source of many of our best ideas. Many of the veterans I've spoken to sometimes have had me laughing so hard it's difficult to control myself as they point out how we could do things better. But we are very, very fortunate to work with a population so eager to serve their country that they do so twice, right? Once in uniform, and then by choosing to partner with us in research and innovation. So one of the innovations I'm really, really excited about is the Million Veteran Program. And I don't think enough people realize what a powerful, powerful tool and asset this is. This was launched in 2011 to develop the world's largest repository of genetic information. Now, some repositories are close to catching up to us, but our unique feature is it's also linked with veterans' longitudinal clinical electronic data. Almost no one has that. And veterans volunteer by sharing their health information and genetic material. So to date, we have close to 880,000 veterans who've enrolled, leading us to the perilously important question, when we hit 1 million, will we keep going? Although I think the answer is absolutely, we'll keep going. But together we're finding out, the answers to some questions, such as why one treatment works better for some people than for other people. MVP, as we call it, has already helped us with regard to predicting cancer risk, diabetes complications, and some mental illnesses like PTSD and depression. And by its very nature, it's very forward-looking. So it's poised to help us study such emergent issues as COVID-19. So we actually launched a MVP COVID-19 survey so that we can learn more about veterans' experience with this virus. And this may ultimately provide some insights into who gets so-called long COVID, how they're impacted, and so forth. But that powerful partnership is at the heart and soul of the Million Veteran Program, and I would argue all of the innovations that we pursue.
Yeah, I think one of the most incredible developments that we're going to see from where innovation's heading towards the future, where really we're going as health systems, is in the quest to achieve high value care has to be centered on what I think of as the journey towards achieving that. What's the path look like? And really what that means is, how do we redefine and how do we imagine care that is not only effective and efficient, that it's equitable, but it's also personalized for the patient. The idea that we can now begin to imagine a state in which we are prescribing the right blood pressure medicine for that individual, or the right cancer treatment for that individual, or in the case of 3D printing, creating a medical device for that individual. It's about that individual sitting right in front of us. And technology can certainly help, I think, and is helping us achieve this idea of personalization. But a larger component to this is going to be partnering with the individuals themselves. There'll have to be a core part of the team in designing the solutions, because you can't do something that's personalized if that person isn't part of it. And so I really appreciate those words, and think that when we imagine the future, when we imagine where we're going, the ability to achieve care that crosses all four of those value horizons, we really can begin to move the needle. And certainly the concerns about not only internally, but globally, concerns about deferred care that happened during COVID, care that may be now prolonged because of the unfortunate consequences of the pandemic. We can begin to think about interventions that target populations that are most at risk, and not trying to boil the ocean, which we know will in some cases be futile. So Dr. Clancy, as you think about where we are heading, both a vision for research and development and innovation, and a large part of the office that you oversee, including what this means for the future training of clinicians, where do you see, and what is your vision for what the future of this looks like within VA and more globally?
First, I just want to foot stomp your idea about the personal journey. I would say for the past 5 to 10 years, there have been a number of people, really brilliant leaders ahead of the curve, who've been working with patients who we sometimes call frequent flyers. For example, if you're the parent of a child with cystic fibrosis, or you have a fairly complicated cancer and so forth, you're probably in the hospital a lot and looking to them for insights. But what you're describing is taking it so much further than that. It matches what a close friend told me once, who had a lot of experience with healthcare. When I asked her, how would we know we got it right with patient-centered care? She said, when healthcare is organized around my day, rather than my needing to, rip everything up to organize around your preferred times, which really got to me. So one of the most essential and critical priorities for us, I think, is ensuring health equity for all veterans and all Americans. And one of the ways we're doing that, of course, is working towards a workforce that looks more like America. As our secretary put it, it's not only the right thing to do, it can save lives. And the work we're doing here is as simple and important as that. And part of the reason it's very important to diversify the workforce is, a study a few years ago found that Black men under the care of a Black physician were more likely to take up suggested screening tests, cholesterol, diabetes, that kind of thing, than those under the care of a non-Black doctor, right? It's that connection, that personalization, or that assumption of personalization. And we've been working on workforce diversity for quite a while through agreements with the historically Black colleges and universities and many minority serving institutions. The research group at VHA, part of our group, is actually got a very special set of initiatives that they're launching. And most recently, we had a summit this summer highlighting clinical training opportunities, scholarships, and research grants for minority physicians and investigators. And if there's one theme I've heard constantly and consistently this year from leaders in VA, but also, frankly, leaders across the country, when wondering and sort of frustrated by the fact that the uptake for vaccines tended to vary by demographic groups, was the importance of listening. So people who I think always thought of themselves as, critical, vital public health experts, and they are, by the way, said that when they turned off the talk mode and started listening to people, they learned a lot, as we did at VA. And right now, Black veterans have a higher rate of vaccination than any other group, which is pretty awesome. But I think that's got to be very much a part of this future vision as well. And what advice do you have, Dr. Vega, for audience members looking to advance potential solutions for veterans?
I always think of it from what do I see that in some ways kills innovation in the healthcare space. There appears to be, at least in my opinion, two really important considerations. And that is the workflow that will eventually evolve and alignment of incentives, meaning that, not to be too business minded, but there's got to be what's in it for me to really drive adoption, utilization, and benefit. And then the workflow has to work, right? Asking somebody to do something that goes above and beyond what they generally do, if there's enormous amount of value, they probably will. But if they can't realize that value, they probably won't, right? We tend to favor convenience. People don't magically change because they walk into the walls of a hospital. They behave and think the same way that they do. They expect the same things that they do outside of the walls of the hospital. So I think there's two really important things to consider. One, you have to really understand the problem that you're trying to solve. And that starts by listening, and really listening to the end users, the individuals who are going to be utilizing the solution, or the individuals who you aim to impact. And listening, and really intently listening to understand the problem you're trying to solve, helps you arrive at a better solution. It also is important to have some diversity of opinion about what you are trying to iterate or solve. Before you get to a minimal viable product that you're testing, have multiple different markets, multiple different demographics, multiple different groups, speed it up. Because the more feedback you get from a larger diversity of population, you're bringing in not only different levels of expertise from professions and different walks of life, but our all shared experiences are different. And that can only help strengthen products and solutions to be better. And then I think another thing that we often miss, but that is so equally important, is the replication and the replication phase. Because something works in one market or one facility or on one group of patients or demographics, does not necessarily guarantee that that extends to now all of a sudden we should scale it and it should be everywhere. Now I always tell folks, if we were starting a surfboard company, the first place we would not go instead of store up is in Topeka, Kansas, right? We're going to go build our company in some place that there are accessible beaches and surf. Now, if we become really, really, really successful, maybe there are groups of people who travel from Kansas to the beach that surf, and they do want accessibility to our product. But that's not where you start. And so remembering that you introduce things and then replicate them in other markets, not only does it help make your solution better, but you learn the natural market from which you can then scale your solution. I think we miss that sometimes, and it's a really important component to taking your project through, getting it in that sort of go-to-market strategy, and then how to think of this at scale. Some people call it the product placement, but in healthcare, I think it's really, does this work in other unique areas of healthcare? An emergency department is very, very different than an intensive care unit. Lots of similarities, but they're different environments. Dr. Clancy, same question to you. I know we've got a couple of minutes. Any advice or thoughts for the teams today?
So I really, really want to foot stomp your observation, Dr. Vega, about solutions that aren't anchored to what people can do and how work moves every day, which you can only learn about by listening, are bound to not be successful. So I think that you're spelling out some of the secret sauce of the innovation ecosystem. I would like to just shine a light on another part of our group, which is VHA's National Center for Healthcare Advancement and Partnerships, fondly known as HAP. The very mission of this office is to fuel public-private partnerships at the national, state, and community level to advance the health and well-being of veterans. And they've helped to forge partnerships with organizations such as the GO2 Foundation, working to increase awareness of the importance of lung cancer screening for veterans, as well as Microsoft Airband, which aims to improve rural veterans' online access to VA services. So if you want to send them a message, it's community engagement, all one word, at va.gov, or you can contact me directly at carolyn.clancy@va.gov. But this is a small but mighty team of people who have never met an opportunity that they refused. And I think that is very, very important pre-work to actually getting to the space of the innovation ecosystem, where we are thinking about how do we scale something that seems like a phenomenal idea, worked really, really well in Peoria, but now we have to figure out, can we actually make something bigger? So this has really, really been a really lovely time to chat with you, Ryan, because as I told your team the other day, the work that you all do is just phenomenally exciting, precisely because it excites so many people, our colleagues, veterans, and so forth, all in the name of providing better care.
Lovely period at the end of the chat. So I appreciate that. Lovely way to end. And a huge thank you to Drs. Vega and Clancy for the discussion this morning. Please give them a virtual round of applause, or the Zoom high five, or Zoom, whatever Zoom function you want to use there. And again, thank you all for the support and for being here today. So we are going to move forward with our panel. So welcome to the Co-Designing for Tomorrow panel. It is a brief panel, and we will feature individuals with unique experiences collaborating for tomorrow. I will try to get to a few questions in the chat at the end of the panel, so please ask away. And I ask the panelists to take a look at those, and if we don't address them, to maybe contact those who ask the questions directly. So some quick introductions here. First and foremost, Gina Adams is the founder and CEO of Wearology, a social venture that creates innovative hardware to restore levels of independence and empower people with physical challenges. Gina launched Wearology in 2018 with the company's flagship product, Buttons to Button, magnetic adapters. And the company collaborates with individuals to develop, prototype, and commercialize adaptive friendly devices. And she is working with the VA in Richmond and the innovation specialist, Catherine Beckner, who is also on the panel, for a new physical therapy portable set of parallel bars. And we're very excited about that. So please welcome Gina and Catherine. Catherine is the Innovation Program Coordinator, Innovation Specialist at the Central Virginia VA Healthcare System in Richmond. In this role, she represents the Innovators Network and the local innovation program at her medical center. She started her career in 2010 as a clinical specialist occupational therapist in spinal cord injury rehab. And she enjoys incorporating the voice of the veteran and VHA in rehab innovations, healthcare solutions, and the future of healthcare. And thank you, Catherine. And then, as you probably have already met, Ryan McLetty is the head of global operations for Founder Institute, the world's largest pre-seed startup accelerator, and our co-host for this event. Ryan works with startup leaders in over 90 countries to help develop their innovation ecosystems and launch technology companies in the region. In addition to his work at Founder Institute, Ryan is the co-founder of VetTech, one of the leading startup accelerators for veterans in the US, serving as an advisor, managing director, and investor. Ryan has directly launched over 500 startups through his roles at Founder Institute and VetTech. So thank you for everything, Ryan, and welcome to the panel. And finally today, last but not least, Sergio Garcia Vergara is the CTO and co-founder of RIF Robotics, where he and his colleagues are leveraging robotics, artificial intelligence, and automation technologies to address inefficiencies associated with hospital surgical instrument supply chain. To effectively develop a useful product, RIF Robotics is currently leveraging the expertise and experience of sterile processing professionals as participants of the Innovators Network Greenhouse Initiative, working with the North Florida, South Georgia VA, Asheville, the Charles George VA, and the, I guess it's Northeast Ohio healthcare system in Cleveland. So welcome, Sergio. So I'm going to start it off with a question for Ryan. How do you define collaboration? Why do you think it's important in healthcare?
That's a good question. I mean, so something that Dr. Ryan Vega said, which really resonated with me, is like really aligning incentives, right? And collaboration is all about working with people who have the same incentive. And that's why I think it's really powerful that the VHA is working with early stage startups to try and align incentives to launch companies and innovations and technologies that can positively impact the healthcare space. And so, at Founder Institute, we say it takes a village to launch a startup. And, that's not only the individual founders, but it's their team, it's their advisors, it's their customers, it's their investors and their partners. And so really, like, none of this is able to be achieved if you don't have collaboration throughout all levels of not only the startup, but also the ecosystem that's surrounding that startup.
Great. And what about the specifics in healthcare that make collaboration important? Why specifically is it important in healthcare?
One of the biggest barriers, and this is sort of like the perception in the startup community, is that if you're going after healthcare providers or hospitals as customers, it's this long, painful sales cycle. You're going to have to, there's so many nuances and red tape that you have to try and overcome, that it's almost like daunting and not worth the amount of time and pain that it will take to get through all of that, to get to the pot of gold at the end of the rainbow, so to speak. And so it's really, really important that organizations like the VHA or other hospital systems lower the barriers of entry for those startups, because they're the ones that are going to be creating new technologies that the hospitals can use. And so collaboration within, organizations and industries that are sort of slower moving, they're more monolithic, like healthcare, it's imperative that the leaders of those organizations recognize that and create either channels or processes or teams to be able to work with those startup companies.
That's exactly what the Innovators Network does and believes in wholeheartedly. Turning it over to VA, Catherine, from the perspective of VA and a VHA employee, why is collaboration important to VA? And tell me a little bit, tell everyone about your experience of how collaboration has impacted frontline employees.
Yeah, I think collaboration is so important to the VA because just like no patient is the same, no concept is the same, and no idea would be fully formed and no solution fully thought out without diverse perspectives and collaboration. So I think it helps to bring as many stakeholders to the table as possible to get that diverse perspective. You know, like Dr. Vega was saying, we can start these concepts or these solutions in their natural market, but we have to get as much perspective and information as possible. And I think that leads to the best solution for the healthcare environment and also for the veterans. So we can collaborate within our own medical center, we can collaborate within our own region or VISN, we can collaborate within the VHA, but also having the opportunity to collaborate with these external stakeholders brings a nice perspective and input and truly continues to formulate the solution and make it the best tool for everybody involved.
Share a little bit as I'm going to kick it to Gina here in a second, but share a little bit about how you've seen the reaction of frontline employees who are not used to this type of work, who are being brought into these collaborations. What is their attitude and kind of what's the impact been?
Yeah, so, you know, we are working closely here in Richmond with Gina and the team for the parallel bars, the portable parallel bars. And everybody working on this project has truly been so excited, and that's no lie. So everybody who comes to the table to demo the device, to trial it, to provide input, even just walking by to check it out, everybody's truly excited by the opportunity that we are able to work with folks outside the VA, within the VA, but also to create something. So it's been a really nice experience to go from the paper prototype in September of 2020, which it's hard to believe it's almost a year now, to having this real life demo here. And I think it's not only brought a lot of excitement to the table, but it's also helped people and clinicians feel valued and also have their voice heard and really, you know that their subject matter expertise has a lot of input and meaning in the development of these devices and can shape what the future of them will be.
Thanks, Kat. And Gina, so tell us more about your experience collaborating with VHA and what you are working on with Catherine, kind of cradle to dream.
That's a loaded question. So thank you very much.
I know. Sergio, get ready because I'm going to ask you the same exact question. So just get the dreams rolling.
Yeah. So last year, our team, Wearology, stepped to a call to action by a senior living center looking for improving access to physical therapy because we know how the compounding health problems with immobility can lead to things like muscle paralysis, right? So I joined the COVID-19 Maker Challenge that was sponsored by the VHA. And when we started looking at the larger problem outside of just being COVID related, that was for seniors that were in quarantine. But the reality is that 90 million people are missing vital physical therapy appointments every year. So we came up with a simple solution. And then since we were invited and to participate in pitch at last year's Breaking Boundaries event, it's basically a dream come true in terms of, from a development standpoint, having that validation, right? We are only here to improve patient outcomes and reduce compounding health problems. And I'm even bold enough to say, maybe we could actually help people to an extent that we can early discharge, right? So my background, I have an MBA. I went back to develop this company through that MBA program, and my background's in product development. So this partnership with the VHA Innovators Network and Catherine and her group bring that expertise that is vital to developing any product, because it's the end user, right? And so we're only interested in bringing something to market that is truly going to benefit our veterans, help people feel better, sooner, stronger, and what better mechanism than being able to bring physical therapy directly to their bed. So we are thrilled to be partnering with the Richmond, Virginia clinic, and as maybe not everybody on this Zoom knows, delivered that first prototype just last July. And so we are embarking on having different, just like Dr. Vega mentioned, having different demographics come in, different clinical departments. And so while Catherine and her team are looking at how this can benefit veterans health, our team is looking on the outside as well as looking for skilled nursing facilities or in-home or inpatient rehab sites, so that we can really get an understanding about the larger market for our first to market prototype.
Thanks, Gina. Sergio, same question to you. What has your experience been like collaborating with VHA, and tell us a little bit more about what you're trying to accomplish?
Yeah, definitely. So my friends and I, we founded RIF Robotics in the fall of 2020. And while we knew that we wanted to develop some technology to help patient outcomes, and we wanted to bring a better quality of life for people, specifically in the healthcare industry, we didn't know exactly what we wanted to develop. And typically engineers are really good at developing some cool new technology, specifically now, with the boom of robotics, that may or may not be useful. And so through countless hours of networking, we were able to find and learn about the Greenhouse Initiative as part of the VHA's Innovator Network. And it's been an amazing experience without exaggeration, because same as Gina's experience, interacting with the professionals in the VA facilities and leveraging their expertise and their experience has definitely helped us better identify what the exact needs are, so that we can better tailor our products. We just finalized our last round of interviews at the last VA facility that we visited, and we are much clearer of the problems that we can address with the technology we want to develop. Moving forward, we are very excited to continue this collaboration, because in the process of developing this technology, we do need to know how it's going to affect the end user, such that at the end of the day, we can actually improve patient outcomes as well as help healthcare professionals do their job, make their job easier.
Thanks so much. And I'm going to go around the horn with the same question for each one of you. And I want to go back and start with Ryan. So Ryan, consider this more, I guess, from the public sector perspective. It's a bit of a tongue twister, but what advice can you give to companies looking to engage in early stage collaboration?
Early stage collaboration specifically with VHA, or just collaboration with anyone?
How do you move that needle forward? And how does collaboration kind of factor into doing so?
Yeah, so I mean, if you're a startup and you're looking to collaborate with industry partners, corporate partners, getting some initial customers, the most important thing is you have to build something that solves a problem that people want, right? And it's so obvious, but it's also so hard to do at the same time, because there's so many nuances in the market. And the most important thing that you can do is really just get out and start talking to your customers, right? And it's important to realize there's so many different types of startups with like marketplaces, multiple different user types. But at Founder Institute, we like to simplify everything. Your customer is the person that pays you, and it's not a role; it's like a specific person. And so you want to go and talk to as many of those people as possible to figure out what is the thing that I need to build that will then help create so much value that that person is willing to pay me for that solution. And it doesn't matter if it's like a consumer product or if it's, a very complex health tech type of company. At the end of the day, someone's paying you to solve a problem, And, the value that you provide has to be worth more than the dollars that they're giving you. So with that premise already established, right, as you're going out to these industry partners, there's certain things that these different organizations throughout the organizational structure are going to care about, right? Someone that controls the budget is going to care about like time and efficiency and saving money. Maybe someone lower down on the chain that's actually using the product every day is going to care more about like ease of use and, how does it integrate with their daily workflow? And so it's important for you as the startup founder to be a subject matter expert in that area. And, the only way that you can do that is by going out and talking to as many people within that organization as you can, listening, making genuine connections, and not necessarily trying to sell them immediately, but just make sure that you're building something that's going to add value. Because, if you go to a partner and you immediately like ask them, for a contract, or you want to sell this thing and you come across too pushy, they're going to put their wall up. But if you come at it from an approach that you're trying to build something valuable that can help them, and you just want to learn and get feedback, that advice is going to be more valuable anyway, because you're going to build something that is worth paying for.
Awesome. Catherine, from the VA perspective, what advice would you give companies looking to engage in early stage collaboration?
Yeah, I would say come to the collaboration with not only, as Ryan said, something that solves a problem, but with a truly open mind. Come ready to ask questions and get a lot of feedback. You don't have to have answers to all the questions that the team may have for you, but come ready to listen and learn from their perspective, because they're coming from the perspective of a clinician that represents patients of all different backgrounds. And to that point, I would also say, I know Ryan's point of view is the customer being, who pays you. And from the VA, I would say the customer with the VA is anybody who's impacted by this solution. And so that impact is really broad within the VA. So it goes from the clinician providing care to the veteran to the secretary checking the veteran in for their appointment. You want to get as much input and feedback from a diverse perspective as possible. And I think that will help make the solution and the tools as valuable as possible.
Thanks, Catherine. Sergio, we'll go back to you. Let Gina go last. But what about your perspective? What advice would you give companies and your peers essentially about early stage engagement?
Yeah, definitely. So I'm just going to echo what the answers have already been. It's about leaving your biases at the door, right? So when you come in with a certain level of expertise in a given area, in our case, engineering and robotics, it's very easy to think about a problem in a very specific way, and you have already your biases defined. So the advice is to leave those out, and it takes effort, right? So we are constantly reminding ourselves we don't have to view problems in a specific way. We can just ignore it. If these bias of these limitations didn't exist, how can we come up with a better product or a better solution? And then this is where collaboration comes in, and listening, like Ryan just said, listening to your potential customers, actually listening what their needs are, and then going from there.
Love it. Gina?
Well, of course, I agree with what everybody has said. So I wanted to actually piggyback on what Dr. Clancy had mentioned in terms of building something that is scalable. And we've tried to take into consideration as we've gone through this process, looking at, what kind of components can we bring that are off the shelf as we're manufacturing, or like thinking about that, because the whole goal is to propel technology, right, and get it into the hands of these clinicians as fast as possible. And so I certainly would be paying really close attention with your engineers that, we're building something that is within our, and what Ryan just kind of mentioned, your budgeting, can we bring value to the customer, but at a cost that we're actually all able to, create jobs, within our own company and within the manufacturers. And then the one thing I would say I'm so grateful for in hindsight is once things start moving pretty quickly, and since we are a new company, I had already applied for my SAMS vendor ID and gotten all of that type of business and operationals aligned in all of our insurance. And so that makes entering these partnerships with the VA much smoother, because it's a tremendous amount of paperwork. So you want to get all of that other information completed early on.
We do like paperwork. We do like process. We love acronyms. You know, we part of, and I can't remember who mentioned it, if it was Dr. Clancy or Dr. Vega. Part of what we're trying to do in the Innovators Network and the ecosystem is making it easier for people to work with us, because it can be a challenge. So thank you all. I'm going to we have a couple questions in the chat, so I'm going to go ahead and go to those, and I'm going to say whomever wants to answer it, go for it. So the first one was actually targeted for Gina and Sergio, and I think that part of it's interesting. So when we have collaborators with the Innovators Network, we aren't just looking to support them in creating something for veterans. We are looking to support them to create something that's going to be for everybody. Our population in the VA does really represent kind of similarities in the general US population. You can find pretty much anything in the VA that you would find, you know, externally. And so it might be an interesting answer to your question here, but the question is, what's your perspective on building dual use tech? So for government and commercialization? And Gina, actually, I might have you go first on that one.
Yeah, I kind of alluded to that earlier, because that is vital. And Allison has been really encouraging. And that's what I love about our relationship with Innovators Network, is that it's a partnership. And we talk with Catherine, we have, you know, frequent meetings. And so to look at, this is a dual development, because we know that people are, there's millions of surgeries every year, right? And so how can we support that recovery? And again, people just want to get back to normalcy, right? Whether that's a catastrophic accident or say maybe something more degenerative. But I think it's really important that we're looking at both streams, because we know that the needs are there. And it's a matter of, you know, identifying and being able to reach those people. So like, again, our call to action was from a senior living facility. So we're hoping that it serves both demographics.
Non-VA senior living center. So really, really dual purpose. Sergio, do you have anything else to add? And I have some more questions coming up.
No, not a lot. It's definitely, the end goal is to improve patient outcomes, right? And that is definitely true for VA as well as non-VA facilities.
Yeah. So for all panelists here, what resources are available to help companies bridge the valley between R&D to commercialization or scaling?
There's a lot of programs and support and resources out there. I mean, Founder Institute's an obvious one. You know, we actually find that a lot of the doctors, the PhDs, the researchers who are like subject matter experts in a particular area, they tend to be good entrepreneurs, but they lack that skill set of knowing how to launch a company, knowing, you know, having that business skill set. And so, you know, it's important to kind of know what you don't know, which is hard. And so, well, you know, things like Founder Institute, other startup accelerators and programs can help kind of fill in the gaps. And so if you're, you know, a deep tech expert, or if you're doing R&D and you want to try to commercialize it, there's also a lot of great organizations out there that can help you with like the licensing of that technology. So we have this great partnership with NASA. They do a good job of getting good license deals for founders. And there's a lot of technology that's already been built that's sitting on the shelf. But at the end of the day, you know, the best piece of advice I can give someone is like, make sure you're working on something that you love and you're passionate about. So don't just kind of like come across a technology or an idea that you think is like really, really interesting and it could make a lot of money. Like if you're not willing to work, you know, 12 to 14 hours a day to try and bring this thing to light, then you might not be passionate enough to make it through that valley of death to do the work necessary to come out on the other side.
was going to call it the Valley of Death, because it seems like that might be a great way to put it. Gina and Sergio, what other resources and what other tools are you using during your journey?
I'm
Let
involved.
Sergio go. Maybe Sergio and then Gina, actually.
Yeah, sure, Sergio.
Yeah, no, definitely. So I'll say two things. One is definitely our network of friends and colleagues, not just from our same field, which is, like I said, our engineering and robotics, but also anyone else who is willing to help us with their experience, right? So when we founded RIF Robotics, this is the first time that any of us have ever founded a business. We've all been very academic geared. And we talked to other friends who founded other robotics companies. We've talked to friends who are surgeons. We've talked to friends who are nurses, friends who are administrators in hospitals. And so we definitely use our network of friends who are in different areas to better help us understand what this journey is going to be like. And we'll continue to do so as we continue to make progress. And then very quickly, a second thing is that, well, like Ryan mentioned, we are trying to leverage as much as possible the programs out there that help people like us who are very new to startups and the startup world. One specifically is the Startup Up Georgia or SIUG program here in Atlanta, founded by the Atlanta Tech Village. That was immense. That was an immense tool that started off the networking process that led to you guys. So it's all about the networking, I would say, as a great tool.
I definitely second that. We are involved at the Lawrence Tech University Centropolis Accelerator, which helps bring physical products to commercialization. And they've been instrumental because they'll provide expert in residence, and they partnered us with our engineers so that we're developing a product that obviously has the structural integrity. The materials are selected specifically for the end use. And then they've also helped us partner with FDA consultants because we're embarked in that process right now. And then with regards to funding, I have to say the SBDC, we recently received a BAF grant. And so, at this point we're self-funded, but through BAF grants and other pitch competitions, we've kind of been able to bootleg that. And of course, the Innovators Network, not only human capital, but they've helped with the development capital as well. So.
And Catherine, I'm going to give you the last word here as we wrap up. On behalf of our entire network and all of your peers, your innovation specialists and the employees, what's your favorite thing about doing this, and why do you love it? Because I know you do.
Oh man, that's a heavy loaded question, like on behalf of all of us. So I hope I do everybody on my team justice, but I do this because, and I think we all do for a lot of reasons. It's because we value the service of veterans. We want to continue to provide care to them throughout the spectrum of their service. We want to make a change in the world, and we want to work with people to bring as many changes into the healthcare setting as possible. So to include the voice of the veteran in the future of healthcare, to impact the future of healthcare, and to continue to collaborate across, boundaries, to continue to break boundaries, to continue to build solutions that are meaningful to a variety of people and populations and that better the world.
Thank you. Thank you all so very much for participating. And thank you for your time and your passion driving innovation in healthcare forward. I know that the VA medical centers will be taking another moment of silence in just a couple seconds. And so I'd actually like to also participate in that again, if you just will excuse all the VA folks to go radio silent for a few seconds around the country, and acknowledge that. You can feel free to type in any feedback or additional questions as we go kind of radio silent here for a few minutes in respect of the situation in Afghanistan. Okay, thank you all very, very much. And, you know, we are all here for, that is the reason we are here. And that is the reason that we do our job every day. And I have yet to meet, out of hundreds and hundreds of VA employees, one that isn't truly genuinely passionate about making things better for veterans. So thank you for acknowledging that. And on that note, and getting excited, let's announce some winners. Yes. So as just a recap of kind of what's next, I'm very excited to announce the winners of the Breaking Boundaries Collaboration Challenge. The following VA medical centers will collaborate with the winning companies on uniquely co-designing and moving innovative solutions of the future forward. Every facility has a lead site, or every company, every collaboration has a lead site. And in the next week, we will ask very quickly to meet with all of the winners and the teams that have been selected to support them to kick things off and to discover a little bit more about needs and asks as we try to scope and kind of formulate the next steps with how the collaboration will actually look, how it will function, how we'll do all the details, logistics, and all that stuff. We will kick off as soon as possible next week. So look for some scheduling information from me in your inbox. And then also the winners today will be invited to demo the progress that they've made so far in the collaborations at the Innovation Experience at the National Press Club in Washington, D.C. In October. I believe that due to COVID, of course, that these will be virtual demos, so don't worry about traveling, but still get the fantastic experience and the opportunity. So on that note, drum roll, please. Our first collaboration winner is Cryoscope Medical. The lead site will be the VA Eastern Colorado Healthcare System, that is Denver, and North Florida, South Georgia. Boston, Charles George, that's Asheville, and Northeast Ohio, that is Cleveland, will also participate in this collaboration. So congratulations, Cryoscope Medical. Next up, Muco Labs, the lead site. Your lead will be the amazing North Florida, South Georgia Veterans Healthcare System. That is the 2020 Innovation Specialist of the Year, Julie Whitney. And you will be working with the Hines VA Hospital, that is in the Chicago area, Tuscaloosa, Central Arkansas, and Little Rock, VA Palo Alto, again, Eastern Colorado and Denver, Milwaukee, and Cleveland. So congratulations, Luco Labs. Next up, Oath Aging Care. Congratulations. You will be working with the amazing Brent Aguilar in the San Francisco VA Healthcare System as your lead, with the Charlie Norwood VA, that is in Augusta, the New Mexico VA, that is Albuquerque, and VA Pittsburgh. Congratulations. Braze Mobility. Next up, the lead site with Braze is the VA Palo Alto Healthcare System and the fantastic Kaylin Essex. And you will be working also with Hines, Tuscaloosa, Central Arkansas, Gulf Coast is Biloxi, VA Western Colorado, which is Grand Junction, Colorado, and the Milwaukee VA Medical Center. Congratulations. Stable. So excited to introduce you to your lead site, Memphis VA Medical Center, Dr. Indra Sandel, the lead there, Orlando VA, Charles George again in Asheville, and VA Pittsburgh. And Cybus Health, Lead site Orlando, the amazing Kim Balicki will be your lead innovation specialist. You will also work with Catherine Beckner, who you just saw in the panel at the Hunter Holmes McGuire, Central Arkansas, Little Rock, Palo Alto, and Sierra Nevada, which is in Reno. Able Innovations, huge interest here, and Edward Hines Jr. VA Hospital outside Chicago with the, which is my hometown VA here. I live outside Chicago, so you'll work with Matt Knight as your lead, and you will work with a host of other sites here. Hunter Holmes, again, that is in Richmond, Orlando, Palo Alto, Eastern Colorado, Denver, Reno, Biloxi, and San Francisco. Invictus, congratulations. You will work with the Richmond VA as your lead site, and the amazing Catherine Beckner, VA Memphis, Orlando, Western Colorado, again, that's in Grand Junction, and VA Boston. Stanley Healthcare, you will be led by the Charles George VA, that is the Asheville VA, and the incredible Caitlin Rollins is your innovation specialist lead. You'll also work with Sheridan in Wyoming, Central Iowa in Des Moines, North Florida, South Georgia, Central Arkansas, Memphis, and Boston. And your VISA, you will be led by Crystal Woolen in Grand Junction, Western Colorado, and you will also work with Sheridan and Augusta, Charlie Norwood, VA. And I think that is all, Ryan, correct? That's it. So congratulations. We are so excited to work with you. We had such tremendous feedback that I was getting from my team around the country about how excited these folks are to work with you and get these things rolling, ready to go. And so for the winners, look out for an email introducing you to the team and setting up a meeting as quick as possible. Again, trying to knock out that bureaucracy, but there are a lot of steps still, and we will get through all of those as soon as we can. I will turn it over to Ryan to close everything out.
All right. Well, first of all, congratulations to all of the winners today. I really enjoyed watching everyone pitch. We also had a great number of high quality companies that submitted their application to pitch. And so the VHA team will also be looking at those submissions as well. You know, I got to say, coming from the private sector, it's really refreshing to see such a large government organization that has such a huge footprint and impact working with early stage startup companies. Most of the time you'll see like big corporations or hospital systems wanting to work with scale ups, but I truly think that the future of boldening innovation within the ecosystem is going to be with working with pre-seed founders. And so that's one of the reasons why we came here to help support this event. Congrats to the FI alumni who also won today. I'm really happy to see that we were able to foster some relationships here at the VA. And for those of you who are interested in launching a startup, Founder Institute is running programs all over the world. We have our VHA, or Breaking Boundaries Fellowship, which is a scholarship to the Founder Institute program for anyone here who's interested in launching a technology company. You can go to fi.co/join/VHA to find out more information on how to apply to that scholarship. And I'm looking forward to the next one. Allison, should we get this on the books for next year?
I mean, I would be totally fine with that. I don't have enough to do, and I like preparing in advance. So it combines the both of those. Let's do it. Let's keep it going.
That sounds great. So congrats again. And thank you to the judges. We had such a great number of people asking questions yesterday. And I know it was sort of a late night for a lot of you trying to get all the information to us. So thank you to the VHA Innovation team. And I'm looking forward to seeing the conference in October. This is going to be great.
Absolutely. And thank you, Ryan, and to everyone in Founder Institute for everything, making this very, very simple for us. And thank you to my team for going with my crazy harebrained ideas, as always. So thank you.
All All right. I think we're good to go. So thanks everyone. And we'll see you on the other side. Take care.